In Tanzania, almost 75% of cancer cases are diagnosed at stage 3 and 4. So this is a major challenge that affects survival rates. Cervical cancer accounts to around 40% of all female cancers that are diagnosed in our country. Unfortunately, in developing countries, including Tanzania, HPV vaccination programs are really in their infancy stage. Secondary prevention interventions are also low in these countries. So, for instance, in Tanzania, we've started screening in the early 2000, but the programs have not been able to be disseminated throughout the whole country.
The maximum distance that patients are coming is around 500 kilometers. So you can check the distance as one of the limiting factors for them accessing the screening facility.
With breast cancer, our patients most of the time present late with huge tumors. Why? It's just because all our society, they always believe that your spirit is in your breast. So if you remove your breast, it means you're removing your spirit. So they are usually reluctant to go to any health facility to be diagnosed. Another myth that they have is they don't believe cancer is a disease. They think it's someone has bewitched them. So to them, they go to witch doctors. So by the time they come to a facility that has the capacity to diagnose them, usually it's already advanced. The Tanzania Comprehensive Cancer Project. This is a project that is very close to my heart. It's a public-private collaboration involving the major cancer facilities in the country. All have come together with one aim: to reduce death and suffering to our cancer patients in the country. The first objective is to improve the oncology infrastructure in the country. The second objective is training now these healthcare workers on palliative care, on cancer screening, to have a high suspicious index for cancer and to know their limitations. And the third objective is research. The research coming out of Sub-Saharan Africa in terms of cancer is very scanty. Now with this project, we want to strengthen that and improve the research output from these facilities. Fourth objective, which is community engagement and cancer awareness, whereby we want to reach the people to make sure that they are aware on cancer and also they're not scared of cancer. And we've done something very innovative. It's going to be the first in the country. We're planning to bring in a mobile screening van, whereby we'll be able to do breast cancer screening, cervical cancer screening, colorectal cancer screening, together with prostate cancer screening in very hard to reach areas of this country.
My personal experience with cancer here in Aga Khan, it's excellent. During the time I was doing chemo, I was telling people what I was going through my social media pages. Through Tanzanian Comprehensive Cancer Project, I was privileged to do training to help other people going through cancer, going through treatment. I started with 3,000 followers. Now I have 400,000 followers. So I have made an impact in society. For me, that's the highest level of happiness. It's a tranquility.
Now we want to emulate this experience that we've got from Aga Khan in all the facilities that are treating cancer in the country. And because of this, I see a lot of hope. Cancer is preventable, it's curable, and even if it's at advanced stage, it's still treatable.